So we are indeed in tune with you right here on YOUFM. And as mentioned, our conversation is going to take place with Dr. Rorisang Mathibe, specialist dermatologist. And of course, we're going to be talking all things that have to do with skincare, especially during the winter season. I, for one, struggle a lot with skincare when it comes to the winter season. I don't know what to do because I've been doing everything right during the summer season. Benekant winter, I am confused. And so in studio, I am joined by Rorisang, Dr. Rorisang Mathibe. Good morning and welcome.
Good morning, and good morning to the listeners as well.
Alrighty, thank you so much for taking the time to actually come through to the studio and have this conversation because I need it. God knows how much I need this conversation right now.
Sure.
I want us to talk about how does cold weather affect our skin and what changes should we make to our skincare routine to kind of adapt to the changing season.
Definitely. Actually, the topic is relevant because already we are in winter.
Yeah.
It's June now.
Yeah.
So I think first and foremost we need to understand that the seasonal change it comes with a low temperature, right? And then low humidity. So now it means we are more in the drier conditions. So the skin routine you have obviously in summer should change a bit because in summer you sweat, so there's natural oils coming out, but in winter your skin becomes a bit drier.
Yeah.
So we need to use things that are more hydrating for the skin, because if you don't, you end up with dry skin, itchy skin. So I think understanding even the lotions, the creams, the ointments, that there's a difference between the three, and when should you use what type of formulation in which season is very important. That's where we do most mistakes. Some people want to go with the lotion to winter, and you need to keep it for summer, and then now introduce creams and ointments in winter.
Sure. It sounds very, very scientific. Very, very scientific.
Sure.
So let's talk about some of the common issues, right? And the common mistakes that people actually face during the winter months.
Yeah, so common conditions in winter, firstly, dry skin. Right, that is the commonest.
Yeah.
And what even makes the dry skin become more drier is that in winter, we tend to bath with hot water.
Okay, please explain more.
So hot water is known scientifically to scrape off the natural oils you have on the skin. And majority of times in winter, what do? We take long hot baths.
Yes, we do. We need them.
Yeah. So that type of temperature actually removes the natural oils on the skin. And now you can imagine if you're someone who naturally has dry skin, because we do have people that naturally have dry skin, it's going to be more drier. And for the fact that there's a season change as well, that will make the skin more drier. And dry skin usually goes hand in hand with itchy skin.
Yeah.
You end up scratching, and then you end up, because of the scratching, you'll have excoriations or ulcerations from the scratching.
Excoriations?
Yeah, it's like small skin ulcerations that you might get as a result of scratching quite a lot.
Okay.
And because now the skin is exposed, you can even end up with infections. So I think the dry skin is the commonest that I see in practice. Secondly, we know there are people that have a condition called atopic eczema or psoriasis, So those type of conditions, most of the time in winter, they become even worse. Because why? Like I said, dry skin itches. When you scratch your skin, you can even, if you are an atopic eczema patient or a person, when you scratch, you end up even making your eczema worse, And the commonest mistake also that we do with those long hot baths, you want to use, something that smells nice, the salts.
Yes, we do.
So those fragranced molecules or chemicals we use can irritate your skin.
Oh my goodness.
Yes, definitely.
Oh my goodness.
Yeah, definitely. And so one of the things one needs to look out for is those stuff like the hot water. We're not saying don't take a hot bath, but it shouldn't be something you do every day.
Okay.
Because you end up damaging your skin.
Yeah.
Also, what is important, especially for the atopic eczema patients, because they have sensitive skin naturally, try and stay away from fragranced products. We've got non-fragranced lotions, non-fragranced soaps, and look for ingredients that talk about glycerin, You know, look for ingredients that talk about hyaluronic acid. You know, look for ingredients that talk about urea. The reason why I'm mentioning those is because these molecules have an ability to attract water. So when you apply it on your skin, you're actually attracting water. And the nice one that I like is that immediately after bathing, don't dry yourself. You know, just leave your skin
self-dry.
You know, damp, and apply your moisturizer. Now, when you use those things like urea, that moisture that you have on your skin will actually, that urea will attract that moisture, trap that moisture in your skin, and you're less likely to have dry skin.
I mean, some of the irritants, you know, can we get into that? Maybe some of the irritants that might even cause, you know, the flare up when it comes to eczema?
Yes. So we spoke about the hot water.
Yeah.
Right. And then perfumes, colognes, and we're not saying don't use them, but try and avoid, especially even in the house. I mean, the air fresheners you use in the toilet, you know, or in the bathroom. Those are molecules that float around, and if somebody with eczema, if they land on your skin, you end up scratching. You know, so those are things that one should look out for. Even the soaps you use, the lotions you use. So now my advice in general, in summary, just say look for non-fragrance stuff, because fragrance is an irritant. Number two, detergents. I don't want to mention names, but look out for bleach. You know, if you are someone who, for example, if you're washing the dishes, if you are a person with eczema, rather use gloves when you're washing the dishes. Rather wear gloves when you're cleaning, because even bleach can irritate your skin. The other day I had a patient who was asking me about roll-ons. You know, alcohol is an irritant itself. So even toners, if you are someone with eczema, stay away from ingredients like alcohol, because those can also irritate your skin, because already you are a person with sensitive skin.
Sure. Okay. All right. Can you just quickly explain the importance of sunscreen, especially during winter? Because we think that the sun doesn't have, you know, as much strength in terms of the sun rays.
Very common.
Yeah, very, very common. So should we apply sunscreen during winter?
Definitely, throughout the year.
Okay.
It doesn't matter whether it's summer, it's autumn, it's winter. Just wear your sunscreen. The issue with sunscreen is that people don't understand that they differ. Okay. We've got what we say organic and inorganic. We've got sunscreens that when you apply, they just stay on top and they reflect light. And we've got those when you apply, they get absorbed and they absorb the UV from the sun, right? So a lot of people would come and say, Doc, I'm using the sunscreen, and since I've started using the sunscreen, I'm breaking out. It's because you're using a wrong formulation. You need to go and consult, for example, to a dermatologist, and then we talk about what sunscreen you need to use for your type of skin. If you're a person with dry skin, I'm going to recommend a sunscreen that is more of a cream, that is more of an ointment. And if you're someone with oily skin, I would recommend gel formulations. So, but sunscreen is very important because it protects against damage from the sun. But also, if you're a person who suffers from, for example, post-inflammatory hyperpigmentation or pigmentation disorders, for you to be able to treat that pigmentation, the first step that you need to do is use a sunscreen, because UV can exacerbate your pigmentation. So every year, every day, use your sunscreen.
So use that sunscreen. It's not just for summer. Let's talk about some of the lifestyle factors that can actually exacerbate winter skin issues, and you know, such as maybe like indoor heating, like you mentioned, and some of the hot showers as well that we take.
Definitely. And we use heaters. So heaters create a dry environment, a warm environment in the house. I understand that, but that heat scrapes away the oils on your skin. Actually, a lot of people would come, if you look at their legs, especially if you spend a lot of time on your heater, you see your skin's trying to form the scales. You know? That is from the heat itself, because heat dries your skin, you know, and the dry environment for the season itself will exacerbate your dryness. But what I would a tip that I would give for people that can get humidifiers, I usually tell them that in the house, in winter, have a humidifier.
Okay.
That will create a moist environment in the house, and it will contribute to hydrating your skin.
Yeah.
Yeah.
And any additional tips for people with dry skin?
People with dry skin.
Chapped skin during winter, yeah?
Yes. Like I said, look for ingredients like glycerin, urea, hyaluronic acid. Those things attract water. Now, that water that you attract, you need to trap it. The simplest thing that you can buy is petroleum jelly. You know, you seal in that moisture that you have on your skin, that little moisture that you still have.
Yeah.
Seal it with a petroleum jelly. But with petroleum jelly, people should be careful, those that are acne prone, because you also don't want to use ingredients that will clog your pores. So I would say for your body, after bathing, after applying that cream, apply your petroleum jelly to trap the moisture. The formulations that one needs to use in winter, it's cream, it's ointment. The formulation that you can use in summer, excuse me, it's lotion. So you can't go throughout the year in different seasons using one formulation for someone with dry skin. So seal in that moisture with petroleum jelly, avoid hot baths, detergents, wear gloves, and with clothing, people especially with atopic eczema, rough fabrics can irritate your skin. So, and we know we get up in winter. So I would advise wear soft fabric like silk underneath, especially if you're a person with sensitivity, because wool material can irritate your skin.
Yes.
You know, you end up scratching your neck. So I would advise wear something silky underneath, and then on top you can put something of a rough fabric.
Oh, okay.
And we like using softeners.
Yes, we do.
That smell nice.
Yes, we do.
That thing that smells nice on your body, it will irritate your skin.
Okay.
So non-fragranced products, I think, are a way to go.
Okay, perfect.
Definitely.
Oh my goodness, I've enjoyed the conversation. You do have a question. How does one deal with removing oil from the face? Because especially, I mean, if you're having oily skin in winter,
definitely,
it means that your skin is very, very oily.
Very oily.
Yeah. How does one person maybe deal with oily skin in winter?
I think over the counter, because obviously that type of a person also needs to come for a consultation. But over the counter, I can just advise, obviously you need to use things that would have things like salicylic acid in them. Those are ingredients that you look out for. Buy products that will say oil control. But now, if when over the counter using those type of things, it's still there, and you've tried even avoiding ointments, formulations, then when you consult with us, there are things that we can prescribe for you to try and control that oil, but we need to actually see exactly what is the main cause, because there are many causes. Even diet can contribute to having oily skin. So you need to sit down with a dermatologist. We do a thorough workup in trying to find out exactly what's the root cause of this oily skin, and then we sort it out accordingly. Because if you don't deal with the root cause, you will always have. It would
always resurface. Just to wrap up our conversation, a question here says, how do we get rid of dark marks and blemishes on our skin?
Again, dark marks, when you say blemishes, you are basically covering the post-inflammatory, what we call post-inflammatory hyperpigmentation. Okay. And it could be as a result of many skin conditions, even acne, the commonest, especially if you have that inflammatory type of acne that will heal with dark spots. The rule is correct what's causing the dark spots first. If it's acne, let's clear it out. Okay. And then there are formulations. As dermatologists, we are trained to come up with formulations to mix for you, to use ingredients that will try and clean up that. But the most important, sunscreen.
Sunscreen?
Definitely. Because UV will exacerbate that pigmentation. UV will make that pigmentation take long to disappear. So if you're using the right sunscreen with our formulations as dermatologists, we can clear out after we've solved
the problem.
What caused the pigmentation.
Okay, so how can people get a hold of you? Thank you so much for this conversation.
It's a pleasure.
I am going to glow. Thank you very much. How can people get a hold of you?
So, yes, like we've mentioned, I'm a dermatologist, but I'm both in government and private sector.
Okay.
So in private, I'm based in Rustenburg at Medicare Hospital, and I'm also based in Pretoria North Medical Center. Okay. But I'm also running dermatology department at Job Shimankana Tabani Hospital, the government sector. So you can get me at those those premises.
Okay, all right. So that is Dr. Rorisang Mathibe, who is a specialist dermatologist. Thank you for coming through.
It's a pleasure.